I have watched multiple videos on different classifications of restorations for composite fillings and answered some questions based on my findings. So the first question is, what is something new you observed by watching these videos? The first thing I observed for class 1 was something called selective etching. The dentist explained that this reduces post-operative sensitivity and that this is where you only etch the first layer of enamel on the tooth. Something else that he also did that I noticed was he used air abrasion before he etched. And then for class 2, I observed the dentist under contouring, making sure that the outer contour was below the contour that they wanted to achieve. He explained that this minimizes the risk of over contouring, which can cause gum irritation or improper occlusion. For class 3, something that I noticed was that the dentist added multiple layers of composite, shaping and curing in between layers. Some even mixed colors to achieve the perfect match. For class 4, I noticed that they were curing on both sides of the tooth, facial and lingual. They also used an impression type material to create what they called a preoperative stent. This was basically an impression of the lingual surface of the tooth. And then they used a translucent composite resin to replicate the lingual side of the teeth, so that they were able to build from that with the composite resin on top of that to create the shape of the tooth. And then for class 5, the use of retraction cord was something that I observed along the gum line. And then the dentist explained that this was to keep the prep dry and free from blood and saliva. And then I also observed them using different layers of composite resin to create the tooth structure and curing in between layers. Then the second question was, what different types of matrices did you see used? For class 2, I observed sectional matrices. For class 3 and 4, I observed mylar strips being used, as well as that silicone putty impression type matrice for number 4. For class 5, I observed cervical matrices being used, and then I observed wedges also being used with some of those. Then the third question was, what type of isolations were used? I observed dental dams, isolation tape called Teflon tape to cover the teeth, and then wooden wedges and retraction cord also. And then for question 4, it was, what are the basic order of steps for this procedure? The first step I have is shade selection, and the second is isolation. And then the third would be cavity preparation. Then the fourth would be etching. The fifth would be applying adhesive, bonding agent, and then / primer, and then light curing that. And then 6 would be placement of composite resin. And 7 would be shaping and contouring to the natural anatomy of the tooth. Number 8 would be to finish and polish. And then number 9 would be to check the occlusion. The question 5 was, what are 2 post-operative instructions after composite is placed? The first one I have would be to avoid chewing on anything hard or sticky for at least 24 hours. And then the second one would be to monitor sensitivity and biting issues or occlusion issues for the patient, and to let the doctor know if they have any problems. And that is all I have, so thank you.